Hi, thank you for checking out this video on auto accident injuries. I'm Dr. Kevin Smith. I'm a doctor of chiropractic and the author of the book, Modern Chiropractic, The Way to a Pain-Free Lifestyle. Since 2001, I've helped thousands of auto accident victims to get out of pain and get back to pre-injury status. I'd like to welcome you to this video. There are 6 million accidents in the United States every year. 3 million of these result in injury, where 2 million result in permanent injury. A collision at only 10 miles per hour can cause damage to the spine and nervous system. Imagine what happens at 20, 30, 40, or even 50 miles per hour. Most auto injuries are musculoskeletal. That means that they involve damage to the muscles and the nervous system. Examples include sprains and strains, whiplash, contusions, and bruises. Whiplash is caused by a violent rear end or frontal collision where the head and neck are whipped violently back and forward. This is a soft tissue injury to the neck and the upper back. Symptoms from whiplash can include neck and back pain, stiffness, headaches, dizziness, brain fog, fatigue, depression, sleep disturbances, memory loss, and more. Facet syndrome involves damage to the facet or zygapophyseal joints and is a common cause of neck and back pain. This condition is often the cause of migraine headaches, pain radiating up into the head, and a loss of movement. Trigger points are small, hyper-irritable spots in the muscles. They can often cause localized or referred pain, headaches, stiffness, TMJ problems, and a loss of motion. Herniated disc involves damage to the outer ring of the disc, resulting in the middle section oozing out and pressing up against the spinal cord or the spinal nerve roots. It is frequently the cause of sciatica, which means pain that travels down your leg. The first people to help auto accident victims are typically the EMTs and the paramedics. Their job is to assess, evaluate, and if necessary, to transport the auto accident victim to the emergency room. The emergency room personnel are the next people to see auto accident victims. They do a consultation, an exam, and order imaging studies, which could include x-rays or a CT scan if there was a loss of consciousness. The emergency department specializes in specific injuries, such as broken bones, closed head trauma, concussions, lacerations or cuts, burns, and blunt force trauma to the chest, eyes, and mouth. It needs to be understood that less than 4% of all auto accident injuries are these type of problems. 96% of all injuries sustained during a motor vehicle accident are musculoskeletal, which, as I said before, involves the muscles and the skeletal system. These types of problems do not necessarily require the services of emergency medicine. The medical care for musculoskeletal injuries, their protocol is generally to prescribe NSAIDs or non-steroidal anti-inflammatory drugs such as Motrin and Aleve, muscle relaxers, commonly Flexeril, and narcotics, which is most frequently Percocet. They will then instruct the patient to follow up with their family physician in a week or two. Most people who continue to experience pain 2 or more weeks after an auto accident will follow up with their primary care physician. Primary care doctors will do the same thing that emergency room doctors do. They will prescribe NSAIDs, muscle relaxers, and narcotics. The research is clear, and it has shown that drugs are ineffective for treating musculoskeletal injuries resulting from auto accidents. Drugs only temporarily mask the symptoms. This approach is not corrective, it's palliative at best. They are also toxic and potentially addictive. Chiropractic care is considered to be an alternative to traditional medical care, which involves drugs and medications. Chiropractic has been around a long time, since 1895, and the research shows it is very effective for musculoskeletal problems. Chiropractic care for auto accident injuries generally involves chiropractic adjustments, soft tissue therapies, and active care rehabilitation. According to current scientific research, this approach works better, it works faster, and it costs less. Chiropractic adjustments are excellent for correcting problems caused by auto accidents. Chiropractic combined with physical rehabilitation are one of the most powerful and effective therapeutic approaches available. We have a free ebook titled The 7 Critical Things That You Absolutely Must Do to Beat Chronic Pain. To get access to this free ebook, please visit us online at www.redapplewellness.net. Thank you very much for checking out this video.